not in case of diabetes. And today we want to look at the diabetes education differently and about other possibilities of helping with this problem. I would like first to share with you a story of a young patient came to our pharmacy with a very high blood glucose. He was just newly diagnosed. His mother came and she was starting to increase the dose as per the educator told her. The pharmacist asked a very simple question: show me how do you inject yourself. They did not remove the cap of the for us could be a very complicated for information for people with diabetes and especially newly diagnosed patient. From here we decided to do some extra research and we found out that 63% of the patients that they come to our pharmacy, they don't know what's their type of diabetes. 40% of them, they don't know what is their A1C. So there's a lot of information that people need to know about diabetes, and what you cannot measure, you cannot manage. We've done a research with Jocelyn Diabetes Center when we came here in Saudi before we start this program at Nahdi Medical Company. And we've noticed that doctors, they have a bigger fish to fry. They do have doctors, the doctors that we visit, especially in governmental hospitals, they are overwhelmed with the amount of the patients that they're visiting. There's no enough diabetes educators in those hospitals. And the average time that the doctor is spending with the patient is from 15 to 20 minutes, which is not enough time for a patient to take all the information that they take. And we all know that in Saudi Arabia, we do have little diabetes educators now in Saudi. So we decided to do something about it, and we thought about who else can help? Who else can help the doctors, the nurses, and all the hospitals now taking care of diabetes? So we thought, we're health professionals, we're available everywhere, we have less traffic at the pharmacy, we have less waiting time, we're cost effective, and we're everywhere. And this is not a new concept in the world. Actually, in USA, Walgreens, they do have diabetes educator pharmacists inside the store. So we collaborated with Jocelyn Diabetes Center, who collaborated with Walgreens, and we asked them to do such a program for us here in Saudi Arabia. Before doing that, we actually asked the key opinion leaders, the doctor, the endocrinologist, do you think that the pharmacists have a role when it comes to diabetes or not, before we start the program? And after we had the workshop with them, we decided that they can bridge some gaps when it comes to the education. What we want to do is to achieve a couple of the 2030 vision, which is shifting from being a hospital-centric thinking to a patient-centric thinking, where we think about the prevention, the diagnosis, the treatment, and maintenance and recovery, and work all as an integrated healthcare system where the pharmacist is part of it. So we decided to have a study to prove the concept that the pharmacists have a role when it comes to diabetes education. We started a program, Yana Sukkari program, with Jocelyn Diabetes Center, affiliated with Harvard Medical School and with the Ministry of Health. We have now at Nahdi more than 61 diabetes educator pharmacists, and we decided to do the program through 3 stages. Now it's the 4th year for us right now, and we're in the 3rd stage with an expansion and alliance. This is how the diabetes clinic or the diabetes education clinic looks like. It's inside a couple of Nahdi stores. I'm proud to say that we've reached 25 clinics so far in 11 cities with 25 diabetes consultant pharmacists. Our aim by the end of this year that we reach 50 diabetes educator clinic. And the reason we got the approval of the expansion is because of the results that I'm going to show you now for the program. The diabetes sessions that they're taking is my medicine, because we are pharmacists, and we've noticed because of the doctor shopping and the patients with type 2 especially, they have lots of medication. So we're giving them extra education when it comes to their medication, the drug-drug interaction. Some of the patients that we found out they're taking the same medication with different brand names. So you will be surprised about the level of education that we're providing here. The lab test, all what we do here is to educate the patients about the lab tests that they need to know and they need to do when they go to their hospitals or to their doctors. My blood glucose, we're educating them about the blood glucose, and we're actually asking them to visit the doctor when it's necessary. We don't change the doses, we don't diagnose any of the patients, and we don't treat diabetic foot or anything like that. We just do simple education. So the method we're having, we're measuring the basic demographic, the number of patients, the baseline, and follow-up result of the biomarkers, the current medication list, the diabetes knowledge, attitudes, and belief through an online form. So it will make it, from my office, I can go online and see the results updating every day. So the diabetes program sessions start with the recruitment, enrollment, implementation of the session, result, and evaluation. The evaluation endpoint are the enrollment, adherence, clinical outcome, self-monitoring blood glucose awareness, and satisfaction. The inclusion criteria for adults, type 1 and type 2, and women only with history of gestational diabetes. The results so far, we have 4,177 asked about the program, 84% of them enrolled in this program, and the follow-up survey, we have 1,343 patients, because this study usually takes for 3 months, because we're asking for the pre and post A1C during this program. The demographic, we have most of the patients coming to us are male, simply because we're a pharmacy and it's very difficult for the female to come to us. Now we're planning to open in malls, so we have more females coming to us, and most of them, of course, are type 2. And the A1C and the biomarkers, I would like to discuss first. We have only 1,600 who provided us with their A1C. It's very difficult because we're not linked to hospital yet. Our aim is that we have like a collaboration with hospitals where the pharmacists and the doctors, they have a proper communication. 877 had the baseline A1C, and the follow-up A1C was only for 500 patients. There was a significant A1C improvement by 1.1%. That's a very good news. We're not changing doses. We're not doing anything but education. So look what an education can do to a patient here. I have only 3 minutes, so I'm going to go fast with the results. The doctor engagement has increased actually after the program. Diet, exercise improved significantly also for those patients before and after the program. And also the medication adherence, we have 52% were non-adhered to their medication after this program. This result has dropped to 13.8%. So, and also there's something very important. Jocelyn, when we started the program, they were just convincing me that we should measure something called diabetes distress scale. I was really hesitant. I did feel that A1C is the right tool to measure the impact of the program. But after reading a lot about it, I think this is a very good tool to measure the improvement that happens with the pharmacist. Diabetes distress scales, it means that those patients, when they come to us and they're confused about their lifestyle, their medication, and all that, there's a correlation between the high diabetes distress scale and the A1C. So we found out that those patients, after the program, they have less, they scored better when it comes to diabetes distress scale, from 84% to 43%, and it shows up, and it's linked to their improved A1C and biomarkers. And the blood glucose monitoring, also we had 83% never checked or rarely checked their blood glucose. This result has improved by 60% as well. The diabetes consultant pharmacist, when we started the program and we've asked people, do you trust the pharmacist as a source of diabetes education? We had a lot of no's, and it was disappointing. But after the program, a lot of people started to trust that the pharmacist also can play a role when it comes to diabetes education. In summary, such a program, education program, our program can help improve the clinical indications such A1C, improve the diabetes distress scale, improve the medication adherence, help the patient to engage more with their doctors when necessary, increase the awareness, knowledge around the diabetes management, and the trust of the pharmacist has increased. I was just going to tell you exactly why we started this program. We wanted to do a community service program for Saudi, and we've done a huge research to find out what is the right cause that we should adopt. And we found out that the diabetes is the right cause because there's a lot that we can do here. And our goal is to be integrated with the healthcare system, work with the doctor, work with the nurses, and work all together. The end of mind would be having such a clinic inside the pharmacy where the pharmacist can call you doctors and discuss the situation of this patient. Thank you very much. Maybe هذه أسرع مرة تكلمت فيها في البرزنتيشن. Thank you very much. يعطيكم العافية.